Hi, Miss Smith.
Hi.
It was really nice talking and getting to know you and TJ. I just wanted to thank you for taking the time to complete that semi structured interview with me. It really helped me to hone in on some of the things that we can work on with TJ. And it's great that you're taking the right steps in order to best help him.
Thank you.
No problem. From speaking to both of you, I've gathered a few areas, a few possibilities of areas to work on for treatment.
Okay.
None of these are full diagnoses at the time. I need to spend some more time getting to know TJ and speaking to his teachers and speaking more to you guys. And I'd also like to see how his behaviors might change over time before we make any sort of full diagnosis.
Okay.
So TJ seems to be showing some behaviors that would be found under generalized anxiety disorder. He seems to worry an unusual amount about grades and upcoming tests, and he has a lot of issues surrounding homework completion. He also seems to have difficulties controlling this worry, which is what we would want to work on in therapy. And both of you reported TJ's irritability, difficulty concentrating, and restlessness, which are all criteria under generalized anxiety disorder. And you also both said that he has exceedingly high standards for himself and a tendency to be a perfectionist.
Yeah, definitely. I just like, what can we do as parents to better assist him with these worries? I feel like we've been trying everything and I don't know what else to do.
So I'm sure that can feel frustrating.
Mm-hmm.
It's really important, obviously, to help give TJ the support that he needs, but also to help him work on his independence so that we can help teach him how to better handle his emotions.
Mm-hmm.
I'll definitely have some more treatment recommendations towards the end.
Okay.
Um, I also want to take some more time to delve into TJ's childhood and past experiences. Generalized anxiety disorder might show symptoms from as early as the age of 4.
Wow.
Yeah. So there's typically 3 risk factors for GAD: difficult temperaments beginning from an early age, behavioral inhibition, and parent-child interaction issues.
Mm.
So I'd like to focus a little bit on how you might be acting as parents around TJ and what kind of behaviors you're modeling around him and other adults as well.
Mm-hmm.
I would definitely encourage the 4 of you to begin some family therapy. I think it would really help strengthen the familial ties amongst all of you.
So my daughter would be in that also, even though she's a lot younger?
Yeah, definitely. I
Okay.
think we could use the time to work on TJ's relationship with his sister and find out more about where all of the anger and aggression is coming from.
Okay.
And we could also see how you and your husband might be impacting TJ's behaviors. There's a very specific type of therapy that we use called cognitive behavioral therapy, or CBT, and it helps to link together thoughts, feelings, and actions. Um, and I know that TJ has had a history of taking SSRIs, but sometimes these can influence behavioral therapy and make it more difficult. So that's just something to keep in mind as we begin treatment, and we'll definitely go back to that.
All right. Yeah, I don't know any about the meds. We're going to have to revisit that, I
Uh
think.
huh. He also seems to be showing some classic signs of attention deficit, sorry, hyperactivity disorder, or ADHD.
I've
Uh,
heard about that.
yeah, it often coincides with GAD. About 25% of those with anxiety disorders also have ADHD. It is usually focused on self-control and organization of behavior. It can affect approximately 5 to 9% of school-aged population and 4 to 5% of teens, and that
Mm-hmm.
number is constantly rising. So there's approximately 1 million kids in the US that have this, so it's a very common diagnosis.
Oh, wow.
And boys are more likely than girls to display the disruptive behavior.
Okay.
So I just wanted to go over some of the core symptoms which TJ seems to be exhibiting, including inattention, which would mean difficulty sustaining attention, hyperactivity, which would mean having a very high activity level, and impulsivity, which would mean poor impulse control. There's also different types of ADHD, which show predominantly inattentive or predominantly hyperactive or impulsive symptoms, or sometimes a combination of the two. So
Mm-hmm.
spending more time with TJ would allow me to try to see which one of those he might have.
Okay.
Those with ADHD might also have difficulty controlling and guiding behavior when thinking about future consequences. So, for example, how TJ might have a lot of intense feelings towards his little sister and say things about her without having much control over what he's saying or how he's acting.
Mm-hmm.
So, a diagnosis of ADHD could possibly explain why TJ is having this difficulty functioning both at school and at home.
Okay.
And then heredity is also a cause for ADHD. Sometimes we might find that a parent having ADHD might have also contributed to this. So that's something to possibly ponder over.
Wow. I've seen a lot of stuff about ADHD, in the news, and I've also heard it, referring to TJ before. Is this something that, has come about because of the way we've been parenting, or something that, like, it's in his diet, or something that we're letting him do that we shouldn't be doing?
No, definitely not. There's many common myths about ADHD, and diet specifications and parenting abilities are definitely two of them.
Mm-hmm.
It's very common for parents to feel as though they're the ones to blame, but this is not the case. There's
Okay.
many other reasons behind it. So,
All right.
just looking a bit on treatment, we have it's been shown that medication um, definitely really helps with ADHD as well as some behavioral therapy. We have very specific treatment options available that combine home, school, and peer consequences.
Mm-hmm.
And we work on talking to the schools to making sure that there's educational accommodations and special education, which might help some of TJ's problems that he's showing at school.
I think that would be really helpful. I mean, a lot of the stuff is at school, and I feel like I don't even really know everything that's going on, so that would be awesome.
Yeah.
Also, really quick, I just wanted to go back to the medication thing, and I mentioned that before. He's been on so many medications, and I feel like it's just not even working.
Okay.
And I'm just really nervous about putting him on even more and just changing it up again, and either not working or making things worse. So, I mean, have these been found to be very effective for kids with ADHD?
I know it can be hard as a parent to see your child being put on medications.
Just makes me nervous.
Yeah, and he's been on a few different medications, so I can understand your concerns. For ADHD in particular, 70 to 80% of kids that have been treated with the ADHD medication have shown symptom reduction.
Oh, wow.
It's hard to be able to predict exactly how an individual child might respond. For a lot of kids, medications might not be appropriate because of how they respond or side effects. So we do see some kids, maybe about 40 to 50%, that don't need can be treated adequately with medication, and it's about 4% of school-aged kids do take it, and it is a very well-researched intervention for ADHD. So we would definitely make you and your husband and TJ aware of any of the medication's side effects if he were to begin anything.
Okay, all right, that sounds good.
So. Thank you very much for your time and for coming in to speak to me and my clinical team.
Thank you. I appreciate all of your help. It's nice to kind of put names to these. I mean, I know you said that he doesn't meet the full criteria for them, but it's nice to know, kind of that there's other kids that are experiencing this, and that, there's some treatments that we can.
There's been a lot of great research that can definitely help. And I know it can be really hard. So again, I would definitely recommend trying some family therapy. I have some names I can refer you if you are interested. And I look forward to beginning treatment with TJ and working with all of you. And please don't hesitate to contact me if you have any questions or any more concerns. Thank you.
All right. Thank you so much.
No problem.